Hello, my name is Angelina Sanchez, and this is my informative speech. If you are at a party, an event, or even a wedding, and you're having a conversation with somebody, but there's really loud noise behind you, or a bass is banging, 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 and you don't really know what the conversation is going, or even if you're just having a conversation with somebody or a family member or a friend, but you're not really understanding anything they're talking about, that's auditory processing disorder, also known as APD, also known as Central Auditory Processing Disorder, CAPD. Auditory processing disorder is a disorder affecting the capability of understanding speech. According to kidshealth.org, it has nothing to do with the physical hearing. The way this disorder portrays is that the ears and brain don't fully coordinate with each other. Something interferes with the way the brain familiarizes and understands sounds, especially with speech. The processing skills they might struggle with according to understanding.org and how they are diagnosed is, well, the first step in discovering APD is to rule out physical hearing loss. Audiologists are the ones who do the testing for APD. They test advanced listening to where their patients listen and respond to different sounds. APD mostly shows up in childhood, but they can't get tested until they're almost about 7 years old. It can be hard to diagnose a patient if he or she has APD or ADHD, because they are often mistaken for one another, or some patients even have both, or they also have the same symptoms in behavior. Some things they might be able to struggle with is auditory discrimination, which is noticing, comparing, and distinguishing between sounds. Auditory figure ground discrimination, which is focusing on the sounds in a noisy area like a wedding, event, or anything with really loud noise, maybe even outside. Auditory memory is recalling what you have heard either immediately or in the future, which can be like, for example, maybe in a classroom and you are sitting there and you're listening to your teacher, listening to your subject, and you either walk out of the class and you immediately don't know what's going on, or maybe it takes you a little while and maybe like about a week or two later, you don't know what's going on. Auditory sequencing is understanding and recalling the order of sounds and words, which could be just in sequence order, like 1, 2, 3, 4, and they might say 1, 3, 4, 2. So it's just the way of the order. Some symptoms that WebMD.com give are all ages can have APD. It can affect the way they speak and the ability to read, write, and spell, so pretty much almost anything that they do in school. It could be also hard for them to talk to others. He or she may not be able to comprehend what other people are saying. Also, it may be hard for them to follow conversations, listen to music, know where a sound is coming from any direction, and remember instructions. Also, understand what people are saying in a really loud setting. Causes and some risks, according to ASHA.org, is brain injuries like brain trauma, seizure disorders, also stroke, low birth weight, and prenatal drug exposure. Treatment pursuant to AttitudeMag.com says, try to modify the sounds to reduce or even get rid of certain sounds. A mix of professional, school, and home remedies is the most effective, but there's no cure for APD. So, for example, you can soundproof your room with like the foam squares, or you can even get cement walls to modify that, or you can also even make your environment very, very quiet and very calm, because whoever in your family does have APD and there's really loud noise, it's going to distract them from that conversation or what they're doing in their daily life.